Hello, and welcome to Puckett EMS's CPAP training webisode. The purpose of this webisode is to introduce you to the new CPAP protocol and to demonstrate how to use the O2 Rescue CPAP circuit from Pullmadyne. We know that CPAP therapy is a non-invasive procedure that can provide effective ventilatory support for patients in congestive heart failure with acute pulmonary edema. The O2 Rescue from Pullmadyne is a compact, easy-to-use, single-patient use, disposable CPAP circuit. This system comes pre-assembled for ease of use and a quick setup time. First, let's review what causes acute pulmonary edema and congestive heart failure, and why is CPAP therapy so effective in not only reducing the work of breathing in these patients, but restoring adequate oxygenation. We know that in CHF, the heart can no longer effectively pump blood to meet the metabolic demands of the body. This pump failure causes blood to back up in the pulmonary circulation, in turn increasing the hydrostatic pressure within the pulmonary capillaries. This increase in hydrostatic pressure forces fluid into the interstitial space, and eventually the fluid seeps into the alveoli, causing pulmonary edema. Fluid in the alveoli significantly reduces blood oxygenation and causes the patient to become severely hypoxic. In turn, the patient's work of breathing is dramatically increased. CHF can be caused by a variety of factors, the two most common of which are hypertension and acute myocardial infarction. Regardless of the cause of CHF, CPAP remains an effective therapy for not only restoring adequate oxygenation, but decreasing the work of breathing in these patients. Now, let's take a look and see why CPAP is so effective. CPAP stands for Continuous Positive Airway Pressure. CPAP, again, is a non-invasive procedure that provides ventilation support for patients in CHF with pulmonary edema. CPAP may prove to be a viable alternative in many patients previously requiring intratracheal intubation by field EMS. CPAP supplies a continuous flow of positive airway pressure throughout the patient's airway. This increase in airway pressure can actually force out the fluid that has accumulated in the alveoli, as well as re-expand any collapsed alveoli, both of which allow for better gas exchange. CPAP also improves the patient's functional residual capacity and dramatically reduces the work of breathing. The goal of CPAP therapy is twofold. One, increase the amount of inspired FiO2, and two, decrease the overall work of breathing in these patients. If CPAP is applied effectively and quickly, CPAP can dramatically reduce the need for the patient to be intubated in the hospital, significantly reduce the length of stay in the hospital, and definitely decrease the mortality rate. Now, let's take a look at the O2 Rescue system and its components. The O2 Rescue generator with a DISS fitting hooks directly to a 50 psi oxygen source. In our case, it'll either be directly to the D cylinder regulator or to the Christmas tree in the truck. There is also a built-in filter to protect any particulate matter from entering the oxygen source. The BiTrack ED mask comes with a multi-positioning Omni clip and a silicone forehead pad. There are dual lip silicone cushions for excellent and comfortable low pressure seal. There are 4 sizes available: adult extra large, adult large, medium, and small. We'll be utilizing the adult large and adult medium. There's also a head strap which comes with dual positioning tabs and attachment clips. O2 CPAP valves provide fixed pressure at any flow rate. The O2 CPAP valves are attached directly to the elbow of the circuit. The most commonly used pressures are 5.0, 7.5, and 10 centimeter CPAP valves. Our protocol will utilize the 7.5 and 10 centimeter CPAP valves. They can be easily changed to any pressure. The circuit also has an anti-asphyxiant valve which allows fresh air intake and prevents exhalation into the tubing in the event of no fresh gas flow. Now let's take a look at the protocol itself and specifically when you would use CPAP therapy. The use of the new CPAP protocol will only be in patients presenting with signs and symptoms of acute respiratory insufficiency secondary to congestive heart failure. In order for CPAP therapy to be used, the patient must meet at least 2 of the following inclusion criteria. 1. A spontaneous respiratory rate of a greater than 25 breaths per minute. 2. An SpO2 reading of less than 95% at any time. 3. The patient exhibits any type of accessory muscle use during respiration. And lastly, the presence of pulmonary edema. There are some contraindications in the use of CPAP therapy. Respiratory or cardiac arrest, a patient's systolic blood pressure of less than 90, patient is unresponsive or unable to follow commands, any type of head or facial trauma that would limit an effective seal with the mask, the patient's inability to maintain a patent airway, patient is actively vomiting or has an upper GI bleed. Any major chest trauma or suspected pneumothorax is definitely a contraindication for the use of CPAP. And lastly, the patient's in hypovolemic shock, CPAP therapy is going to be the least of your worries. Here's the flow algorithm for the new CPAP protocol. All patients must receive a thorough assessment including vital signs, pulse oximetry on room air, cardiac monitoring, and the initial administration of oxygen via non-rebreather at 15 liters per minute. Does your patient meet 2 or more of the inclusion criteria for CPAP intervention? If they do, proceed on. If not, continue with standard ACLS protocol for respiratory distress, CHF, and rapidly transport. You always need to consider the need for advanced airway management. If the patient does meet 2 or more of the inclusion criteria, does the patient meet any exclusion criteria or contraindications? If not, follow the procedure for administration of CPAP, which we'll demonstrate here shortly, starting with a 7.5 centimeter CPAP valve. Reassess, record patient vital signs and respiratory status every 5 minutes. Is the patient tolerating the CPAP without anxiety? If they're not, the protocol does give you the ability to contact medical control and request orders for Versed 1 to 2 milligrams, as long as the patient's systolic blood pressure stays above 90. If the patient is tolerating the CPAP without anxiety, are they improving? If they are, continue with the CPAP and reassess the patient's status every 5 minutes and transport. Continue transport to the receiving facility and notify the receiving facility that the patient is on CPAP therapy. Once you get to the receiving facility, meet with the respiratory therapist and they will exchange the CPAP circuit. Currently, the only hospitals involved in this CPAP study are going to be WellStar facilities. If you transport to any other facilities other than WellStar, you will not be reimbursed with the circuit. If the patient's conditioning is not improving after the initial 7.5 centimeter CPAP valve, replace the CPAP valve with a 10 centimeter CPAP valve. Again, monitor the patient. Any significant improving should come in just a matter of a couple minutes. Is the patient's conditioning improving? If so, continue with the CPAP therapy, reassess every 5 minutes, and notify the receiving facility that you indeed have the patient on CPAP. If the patient does not show improvement with the 10 centimeter CPAP valve, continue standard ALS protocol for respiratory distress, consider the need for advanced airway management, and continue transporting the patient immediately. Again, advise the receiving facility of the patient's dire respiratory status. Now, let's look at a demonstration on how to properly apply the O2 Rescue CPAP circuit. Once you've determined that your patient meets the criteria for CPAP, reassure the patient that the procedure you are about to perform will help their breathing significantly. Ensure your patient is given immediate high-flow oxygen. Attach pulse oximetry and apply the cardiac monitor. Determine the appropriate size mask to maintain an adequate seal, and remove the mask from the inner bag. Attach the circuit to the mask. Verify adequate oxygen supply and attach the high flow generator to the DISS fitting on the O2 regulator. Ensure the coupling is seated evenly and rotate clockwise for a snug fit. Do not over tighten. Hand mask to the patient for them to place on their face. to get used to the flow. Then proceed to put the head strap on the patient. For all mask styles, flip the head strap forward and place the mask on the patient's face. Pinch the Omni clip and slide it up or down to find the best position on the patient's forehead. Flip the head strap back over the patient's head and adjust equally to a proper fit. Next, attach the bottom 2 clips and adjust for a snug fit. After a few minutes, ask the patient if they feel any improvement in their work of breathing. If not, replace the 7.5 centimeter CPAP valve with a 10 centimeter CPAP valve. Ensure that the new CPAP valve snaps firmly into place. If the patient is experiencing wheezing due to bronchoconstriction, prepare to administer an inline nebulized treatment. Prepare the nebulized chamber as normal. Use the special T-adapter to connect the nebulized chamber directly to the CPAP circuit. Once you have a desired aerosol mist, you must remove the elbow circuit from the mask. Connect one end of the T-adapter to the circuit elbow and the other end to the mask. Continue to monitor your patient for signs of improvement or deterioration and transport immediately. Well, that concludes the CPAP training webisode. Thank you for your attention. Feel free to review this webisode as many times as necessary to become comfortable with how to use the O2 Rescue from Pulmodine. I'll be coming by and meeting with you individually to do a skills checkoff and look forward to seeing you out in the field. Take care and be safe.